Inside any mid-size practice, the volume of work required to keep eClinicalWorks running effectively never slows down. Scheduling, prior authorizations, and inbox management stack up daily, outpacing the hours your team has available. When the administrative backlog spills over, the burden falls heavily on providers. Clinical staff spend their evenings clearing out charts long after patients leave. The math on this time drain is well documented. According to National Institutes of Health Research, clinicians require up to 2 additional hours of electronic data entry for every hour of patient contact. This ratio scales up over a week, expanding to an average of 13 hours spent on indirect patient care tasks on top of clinical schedules. The consequence? NIH data reveals physicians lacking sufficient documentation time carry a 2.8 times higher risk of burnout. To protect providers, managers naturally pull front desk staff into documentation support to fill the gap. Those administrative team members quickly become fatigued trying to manage 2 demanding jobs at once. Operating a lean in-house team breaks down when your core digital infrastructure requires a massive, dedicated human effort just to maintain basic functionality. This administrative strain has created a chronic structural problem across the industry. Recruiting and keeping good support staff is harder than it has ever been. According to the Medical Group Management Association, 8 in 10 medical group leaders spend more time recruiting and interviewing candidates than the year prior. The reason for that constant hiring cycle is clear in the data. Front office and medical assistant roles consistently experience a 40, even with a good replacement. Bringing them up to speed on eClinicalWorks modules creates a 30 to 90-day productivity lag where errors rise. Mid-size practices with 2 to 10 providers rarely have cross-trained bench depth to absorb that lag. There is no dedicated HR department to speed up processes and no budget to overstaff. With turnover sitting at 40%, practices face a simple operational reality. Tasks like prior authorizations and patient follow-ups continually stall out while you train the next hire. Practice owners often look at the base salary of an administrative role and assume that number represents what the employee actually costs the business. That math ignores the cost of replacement. Gallup and Salary.com research shows that vetting, interviewing, and carrying the productivity gap of a new hire costs between 50% and twice the departing employee's annual salary. Even without turnover, a standard $35,000 base salary is just the starting point. The real cost includes heavy financial inputs like employer-sponsored benefits and mandatory payroll taxes. Starting from a $35,000 base, you stack on $8,500 for benefits, $2,700 for taxes, plus training, space, turnover, sick leave, and management overhead. Compressed, the fully loaded cost for one in-house administrative seat reaches $60,800 annually, and that $60,800 investment buys volatile coverage. Every sick day, PTO week, or sudden resignation creates an immediate drop in clinical support that the practice still pays for. Practices stretch their budgets paper thin because they calculate overhead based on a fictional base salary, committing to expensive local volatility rather than predictable infrastructure. To solve this, a growing segment of mid-size practices are bypassing the local hiring market entirely. They are outsourcing the work to trained virtual medical assistants who operate exclusively within healthcare administration. These remote professionals focus entirely on navigating digital medical records, undisturbed by ringing phones or the demands of an active waiting room. Services like Staffingly assign dedicated virtual medical assistants to your account. They work U.S. business hours, operating directly inside your practice's specific eClinicalWorks environment, not bouncing randomly between different client accounts. This structure changes the math entirely. Staffingly provides a dedicated 45-hour-per-week team member for a flat cost of $21,600 per year. That includes benefits, backup coverage, and training. This matrix shows the comparison directly. Placing the true in-house cost next to the Staffingly model reveals a massive financial gap, $39,200 in savings per seat. But capturing that savings requires an operational trade-off. You have to stop relying on undocumented tribal knowledge and commit to clearly defining your workflows so a remote team can execute them properly. For practices formalizing processes, that trade-off converts a persistent hiring headache into a reliable, standardized operation, securing a 64% reduction in staffing costs. This remote infrastructure is also backed by technology that makes the work faster. Staffingly integrates AI tools designed specifically to accelerate human task completion, catching errors before they slow down the queue. Document intelligence reads and categorizes incoming faxes, while an automated error prevention layer learns your specific workflows to speed up prior authorizations and inbox routing. This diagram outlines the security protecting that workflow. This is enterprise-grade compliance, verified by HIPAA, SOC 2 Type 2, ISO 27001, and HITRUST certifications, ensuring patient data remains completely secure. Quality control is also built into the cost. Every account includes a reporting hierarchy, featuring a team leader for daily supervision, a process manager for quality assurance, and a customer success manager. That structured oversight means you don't have to spend your own clinical or management hours constantly monitoring whether the remote team is hitting their metrics. By pairing AI-driven task efficiency with strict, verified compliance protocols, practices completely bypass the security liabilities and management drain of unstructured remote work. This model operates at scale. Staffingly has successfully deployed this exact setup for over 800 practices across all 50 states, generating more than $14 million in measurable operational savings. And while transitioning workflows might sound like a massive project, the timeline is drastically shorter than carrying an open job requisition on Indeed for 2 months. This timeline chart illustrates the difference in deployment. A typical in-house cycle takes up to 90 days of recruiting and training. Staffingly shrinks that timeline, getting your EHR access, HIPAA configurations, and workflow orientation fully live in 48 to 72 hours. Because there are no long-term contracts required, practices can validate the system through a 2-week risk-free pilot. You see exactly how the remote team handles your specific setup before making a hard commitment. Looking at the scorecard, the outsourced model clearly outperforms the local hiring alternative across cost reduction, turnaround speed, turnover risk, and built-in compliance. The practical next step is simple. Evaluate your current eClinicalWorks backlog, document the tasks eating up your clinical hours, and initiate the pilot program to see the difference firsthand. The math proves that outsourcing eClinicalWorks saves money. The only remaining question is how many more months you want to absorb the $60,000 cost and 40% turnover rate of trying to do it all in-house.